Preserved renal allograft function and the PD-1 pathway inhibitor nivolumab. In the limited number of reported cases in which these antibodies have been used in patients who have undergone kidney transplantation, these agents have been associated with cell-mediated and antibody-mediated rejection. A 70-year-old man with the end-stage kidney disease of bilateral nephrectomy for renal cell cancer underwent a kidney transplantation in 2010 with one of 6 HLA mismatches between the recipient and the graft. In early 2015, the patient received a diagnosis of microsatellite stable metastatic adenocarcinoma of the duodenum with intestinal obstruction and liver metastasis. He did not have a clinically significant response to treatment that included the administration of standard chemotherapy and discontinuation of mycophenolate mofetil, decreased doses of tacrolimus and intestinal stenting. The patient received basiliximab and glucocorticoid induction followed by initial immunosuppression that included a glucocorticoid, tacrolimus, and mycophenolate mofetil. Inhibition of immune checkpoints with the use antibodies targeting programmed cell death on monoclonal antibodies against cytotoxic associated antigen 4 has been used clinically in patients with various types of cancer. The patient's donor-specific antibodies remained absent. In October 2016, his serum creatinine level was 0.98 milligrams per deciliter, and no further progression of cancer was evident of serial imaging. He had no other organ immune-related adverse event or toxic effects. We report on a patient who received a renal transplant from a living related donor. In this patient, a regimen of preemptive glucocorticoid and sirolimus may have prevented the adverse immune response of nivolumab in the kidney transplant. The patient donor-specific antibodies remained absent. His serum creatinine level and no further progression of cancer was evident on serial imaging. Inhibition of immune checkpoints with the use of antibodies targeting programmed cell death 1 or monoclonal antibodies against cytotoxic lymphocyte-associated antigen 4 has been used clinically in patients with various types of cancer. In conclusion, the use for the mTOR inhibitors has been well studied in many cancers. 5 in these patients, sirolimus may have played a synergistic antitumor role in addition to being an immunosuppressive agent. The effectiveness of combination of a glucocorticoid and sirolimus in preventing immune-related adverse events associated with PD-1 inhibitors it's not known.